Hello and welcome to the Austin Center for Radiation Oncology. I'm Dr. Richard Garza. I'm a radiation oncologist, and I've been here for about 7 years. During that period of time, I've really seen this clinic focus on its strengths, which is the treatment of prostate cancer. We're considered a high-volume prostate cancer treatment facility. I see about 600 patients per year, and I counsel them through what their options are for treatment. Not everybody picks radiation, which is fine, but our goal is to really help you through the process of which treatment's the best option for you. And we want to assure you that if radiation's your best treatment, you're in the perfect place for that. And over that period of time, I've also seen that people have some of the same universal questions. And one is, wow, I've never been through this before. I'm not sure what to expect. So our goal is to really help you explain the process of setting up the radiation therapy, getting a daily radiation treatment. We're going to talk about short-term side effects, long-term side effects, as well as cost, because that's very important. But also, people want to know, am I in the right place for this? Do they have the right equipment? Is the team a good team to work with? What's it like on a daily basis coming in here? Is it sad? Is it a happy place? Is this someplace that I'm going to feel comfortable? And that's what we're going to attempt to answer your questions today. You'll get a more tailored review of the process when they actually come in for the consultation. One of the first steps in understanding what your treatment options are is to understand where you're coming from. Where are you on the spectrum of the disease? Am I localized prostate cancer? Am I advanced prostate cancer? Or am I metastasized prostate cancer? We're going to help you with that. But probably the most important thing is to understand what stage you start with and which risk group you fall into. There are standard risk groups that are assigned by the national organizations, such as low-risk prostate cancer, all the way to very high-risk prostate cancer, and each one is treated differently. Sometimes radiation therapy is the key player, sometimes it's surgery. Sometimes people have already had their prostate cancer treated with surgery and it returns, so they need radiation therapy afterwards. Our goal is to really help you find out where you started on the spectrum of the disease. Sometimes radiation therapy is the best option for you, sometimes it's not. Sometimes you need a combination of therapies that include surgery and radiation and possibly hormonal therapy. The goal is to find out what's best for you.
Thing I have, it's very individualized. When I meet patients, we'll discuss their type of cancer,
Mm-hmm.
uh, whether the cancer needs to be treated right away, what it's like
Mm-hmm.
to get radiation therapy. Do you run through that kind of thing?
Kind of. I have an idea in my head which way to go next.
Go
Yeah.
for it.
In order to understand if radiation therapy is appropriate for you, you have to know what's involved with radiation, both logistics, short-term side effects, long-term side effects, as well as cost. So that's what we're going to walk you through. But almost universally, radiation therapy always starts with a planning process. The planning process involves setting you up and customize the radiation specifically for your body. And that typically involves a customizing session, also referred to as a CT simulation. That's where we take your body, form it 3D in the computer system, minimizing the radiation to the normal parts of your body. There are a couple of things that we have to enhance that process that makes that mapping session a bit more specific. And sometimes that's the placement of gold fiducial markers into the prostate, or a spacer gel between the prostate and the rectum if you still have a prostate. But most importantly, it's about making sure that your anatomy is perfect for each treatment, something that's reproducible and comfortable for you. One of the universal questions that people almost always have is, am I in the right place to get treated? And that really depends on several factors. Do you feel comfortable with the physician's relationship and that he understands where you're coming from? Two, does he have the expertise to treat my prostate cancer? What is their technology like? Do they have the latest technology to treat prostate cancer and minimize the side effects? And that's what we're going to answer for you today. Here at the Austin Center for Radiation Oncology, we really specialize in treating prostate cancer. Not just a little prostate cancer, a lot of prostate cancer. We're considered a high volume treatment center. What that means to you is that everybody from the front desk to the physician and to the therapists that actually give you the treatment have the expertise of treating prostate cancer. From 6 a.m. in the morning till about 5 p.m., we treat prostate cancer. 99% of what we do is prostate cancer, so we get pretty good at it. From the therapists that bring you into the room to line you up and identify your prostates to the therapists that actually treat you, make sure you're in the perfect spot, and actually initiate the radiation plan are all trained specifically to treat prostate cancer. They can find a prostate on our CT images extremely well. You don't want to go to a place that does prostate cancer every once in a while. You want somebody who does this all the time. Most people often focus on the technology involved in treating prostate cancer, typically with radiation therapy machines, and they're looking for the latest model. Here at the Austin Center for Radiation Oncology, we've got two models to pick from, and one is best suited for you. One of the advantages of the Austin Center for Radiation Oncology is we're deeply tied with the urologist, so we have access to the electronic medical record as well as your history over a period of time. This really helps enhance the experience that you have when we don't have to repeat exams that your urologist has also done or have to repeat any tests that they've done in the past. During the consultation, we're going to walk you through the process of what's involved before you actually get on the treatment table, what it's like to be on the treatment table, and what happens after you're done with your treatment. Almost every situation where radiation is used, we have to customize the radiation for your body, specifically for you, and we take into consideration those differences. It starts off with a CT simulation. Depending on the type of cancer you have, we may do some special procedures before that simulation process to even increase our accuracy. And sometimes that includes putting some fiducial markers in your prostate, markers that are there so we can track your prostate, maybe inserting a spacer gel to help protect the rectum a little bit more, and also making a custom mold for your legs so that every day that you come in, you're in the same position. It also involves coaching to help you keep your bladder full as well as your rectum empty. During the radiation therapy, we really want to focus on the cancer itself and keep as much of the normal tissue out as possible. One of the techniques that we talk about is keeping your bladder full, which actually distends your bladder so it pushes the normal structures out of the way, such as the intestines. And you want to keep your rectum empty so that your prostate is not anterior displaced or pushed out of the way. Our treatment machines are very accurate. It's down to millimeters, but it all depends if the patient's in the correct position. So our therapists are trained to have you lined up perfectly, first using skin marks, and then essentially using image guidance to fine-tune the process for you. Our machines are very sophisticated and they can actually track the prostate. So before each treatment, we use a low-dose CAT scan to help find your prostate. And there are a few things that we can add to your prostate to make sure that we can track it even more precisely. So one of the techniques we use is placement of fiducial markers into the prostate. These are small pellets that are made out of gold, so they don't interfere with medications, they don't interfere with MRIs, and they don't interfere with airport scanners. They're very simple procedures and adds that extra level of accuracy that we really take advantage of. One of the other goals of radiation therapy is to really decrease the amount of radiation to the normal structures. And the ones that are very close are the bladder and the rectum. And there's a novel approach to actually protect the rectum by pushing it away from the radiation field. and that's a gel called spacer OAR. It's a new gel that's actually inserted through the perineum that goes directly between the prostate and the rectum, and it creates a buffer zone. In the long run, the goal of this is to decrease the side effects such as radiation scar tissue. The bladder is another organ that's nearby, and the way we protect the bladder is by coming in with a full bladder. The more water you drink, the fuller your bladder is, the more distended it is, the more it pushes the normal structures away. And that's an advantage to helping reduce the side effects in the long run. One of the other most common questions is how many treatments do I have to do? Well, it's really individualized to the patient and depends on where you are in the spectrum. So the goal of radiation is really to deliver a high dose of radiation to a very specific area. And depending on where you are in the spectrum of the disease, we may have to increase our radiation field to also cover areas that could potentially hide the prostate cancer. Depending on how much of the normal tissue we have in place helps us determine the number of treatments. For example, if you have low-risk prostate cancer, you're going to need fewer treatments than somebody who has high-risk prostate cancer. And the number of treatments can really vary. They can be as low as 5 treatments or as long as 45 treatments. It really depends on where you are in the spectrum of disease and how big the radiation field has to be. To get a radiation treatment is actually pretty simple. Once your schedule and plan is designed, most people get here 10 minutes before their appointment time. They're going to prepare for the treatment by emptying their rectum and start drinking 16 ounces of water, typically an hour before the radiation therapy appointment. They'll arrive at the radiation center 10 minutes ahead of time to change into scrubs or change their clothes. They'll spend about 15 minutes on the treatment machine, and the radiation's effectively on for about 3 or 4 minutes total. It's a relatively simple process. When you're on the table, there's no nausea, there's no vomiting, there's no fever, there's no chills, there's no burning sensation. If you drive yourself here, you can almost always drive yourself back. Now, one day out of the week is doctor day. That means you get your treatment and you come to the doctor's office and we talk about your side effects. Typically, the first week will say, this is easy. I don't feel anything. I'm not crazy about the traffic around here, but the actual treatment's pretty easy. About the second to third week is when the inflammation starts to build up. And some people describe going to the bathroom more frequently during the daytime and at nighttime, both for bowel movements and for urination. Somewhere around the fourth to fifth week, some people may have some referred pain. That is, a pain at the tip of the penis, where we're not giving any radiation therapy, but it's actually a referred pain from the inflammation on the inside. Some people say my hemorrhoids are itching, and sometimes they need a hemorrhoid cream. We're not giving radiation directly to those areas, but it's often referred from the radiation on the inside. As soon as you're off the treatment table, you're no longer radioactive. You go home and you're not going to expose your loved ones or any of your family members to radiation therapy, and you're not going to set off any type of Geiger counter. As you go through the process, we evaluate your side effects week by week to see if your side effects are appropriate for as much radiation as you had. At the completion of therapy, we're going to set up some appointments for you. We're going to make sure that you have a return visit to see Dr. Garza and an appointment with your urologist. And we're going to set a schedule where we check your response to therapy by checking your PSA. Over a period of time, we expect your PSA to have different types of responses depending on where you are on the spectrum. Patients are always curious, what else can I do besides the radiation therapy to enhance my response and to lower the side effects? During the course of treatment, we're going to talk to you about diet. In reality, there is no special diet for prostate cancer. It's the same heart-healthy diet you're supposed to be on already. But there are certain foods that can aggravate your symptoms, and if appropriate, we'll give you a list of foods that can help reduce those side effects in the long run. If you have too much gas production, we have a list of foods that can actually help decrease the amount of gas that you have. One of the biggest mistakes that people make when they're on radiation therapy is they take it too easy and they don't exercise. Well, let's say after 2 months of no exercise, you're going to be tired, not from the radiation therapy, but basically because you're deconditioned. So exercise is always definitely important. We recommend a combination of cardiovascular exercise as well as weight resistance. And we can give you tips on places that can help you with that if you need a prescription for a physical therapist or just motivation for self-help using a web program or a personal trainer. One of the ways for us to help you best maximize a response to radiation therapy is to bring a list of your medications, not just prescription medications, but also supplements. And we're going to review those supplements for you. Radiation therapy works through an oxidative process, so it's important that we look at your medications to make sure you're not taking any extra antioxidants that can theoretically work against the radiation therapy. Don't get me wrong, antioxidants are great for prevention of prostate cancer, but during treatment, they can really deter the benefits that radiation provides. For certain types of cancer, typically a bit in the middle group or more aggressive group, we have to use hormones as an adjunct to the radiation therapy. Those are things that help the radiation work better. One of the most common is hormonal therapy. Hormonal therapy comes in different forms. You may hear us refer to it as Lupron therapy, but the main goal of hormonal therapy is to take away the food that the prostate cancer is feeding off of, and that's typically testosterone. So we'll give you a medication that may lower your testosterone levels down to very low levels so that it starves the prostate cancer. Hormonal therapy definitely helps radiation work better. It helps to shrink your prostate so you start to pee better, and it kills more cancer cells in places that radiation can't reach. The bad part is that you can go through menopause for men, and that means that you get symptoms like hot flashes. You lose your sex drive along with it, but most importantly, if you don't exercise, your muscles will get smaller, and if you don't exercise, it's very easy to put weight on. So it's definitely important to keep those things in mind. Now, hormonal therapy definitely helps radiation therapy, and some people have to be on it for a brief period of time. Some people have to be on a long period of time. It really depends on factors that we see on your pathology report, and we're going to go over that with you. One of the fortunate things about prostate cancer is that it's not lung cancer, it's not pancreatic cancer. Those are all diseases that can really shorten your life measured in months. With prostate cancer, you're going to live for years. So it's important to pick a treatment that has a side effect profile that you're willing to live with. So we're going to go through a detailed chart with you, and we're going to compare prostatectomy, which is surgery, against two different forms of radiation therapy, and we're going to talk about very different endpoints. We're going to talk about a sexual score, how your erectile function is going to be affected. We're going to talk about urinary issues, both the ability to hold your urine and the ability to more effectively empty your bladder. We're going to talk about a couple of key important endpoints. Most specifically, we're talking about sexual function, the effect that treatment has on erectile function. We're going to talk about urinary control. We're going to talk about effects it has on the rectum in terms of bowel movements. And ultimately, we're going to talk about your vitality score. Each one affects each of those endpoints very differently. We're going to talk about which one is the one that's best suited for you. In general, radiation therapy is very well tolerated, but you can have radiation or cancer therapy induced fatigue. Typically, that fatigue will get better as you go through the course of radiation therapy and as your body adjusts. But there are some people who have fatigue for different reasons besides the radiation therapy, and those are emotional issues. So we're going to help you decide how to deal with anxiety, how to deal with difficulty sleeping, and how to make this fit into your new lifestyle. In general, radiation therapy is very well tolerated. There are some people who experience excess fatigue for different reasons. It could be the addition of hormonal therapy, it could be the logistics of getting to treatment every day, or it could be psychological issues. And it's not unusual for people to have a certain level of anxiety associated with treatment or the diagnosis of cancer in general. We have resources available to help you through that. During the course of radiation, a lot of your questions are going to be answered, a lot of your anxieties are going to start to be addressed, and you'll start to get into a routine that works for you. It's also important to understand that the diagnosis of prostate cancer doesn't just affect you, it can also affect your family. So we have resources that we can reach out to help you address any anxiety issues, any issues that your family may be experiencing along with you. Earlier, I expressed the importance of the team that's treating you and their expertise. But at Urology Awesome, we have part of our members of the team that are outside of the institution. And they include people that can help with addressing anxieties that you may be having, anxieties that your family may be having. We have resources available to help you have a better exercise program specifically tailored for you, such as if you have a bad back or bad knees. A lot of people say, I don't exercise. Well, you should still exercise, you just have to modify that exercise. So we have access to a physical therapist. If you need additional resources in terms of dietary issues, we have nutritionists that we can reach out to. So the expertise of our team isn't just limited to the Austin Center for Radiation Oncology, it really extends out into the community. Ultimately, when you've decided where you're going to get treated, if you're going to be treated with radiation therapy, rest assured that the Austin Center for Radiation Oncology has the expertise available. And we have a passion for delivering state-of-the-art care. In 2010, when we opened the center, we were one of the first places to really specialize in a type of cancer, not just in radiation therapy, and we were one of the first sites to really bring image guidance to full use. We've done that again with the addition of our new Halcyon Therapy Center. We've done that again with our Halcyon treat machine, bringing the first one to Central Texas. And we've done that with our Halcyon unit, our new radiation machine, the first one in Texas to treat humans. We've covered a lot of information today. It's a lot to take in at one time. We've created a website full of useful resources to help you through the process of understanding what's involved in radiation therapy. That website is austinradiation.com. I'm Dr. Richard Garza, a radiation oncologist at the Austin Center for Radiation Oncology. I look forward to seeing you in a consultation. Hi, I'm Dr. Richard Garza. I'm a radiation oncologist here at the Austin Center for Radiation Oncology. One of the questions that everybody has on their mind is, am I going to a place that has state-of-the-art equipment, and do they have the latest technology? And at the Austin Center for Radiation Oncology, I think we've got everything here that you need for treatment of your prostate cancer. I want to talk today about the two options of the treatment machines that we have available for treatment of prostate cancer. The first machine is our legacy machine. It's been upgraded to have the latest state-of-the-art options. That's called our linear accelerator, or the IX. That's its model name. We also have a brand new accelerator called Halcyon. It's the first one in Central Texas, and it's the first one in Texas to actually treat people. Let me just refocus here.
So the way I started it off was radiation therapy uses, radiation therapy uses high doses of radiation to eradicate the cancer cells, that kind of thing.
Cool.
However you want to say it.
Okay.
So we have to assume people haven't watched the other one.
Yeah. The main goal of radiation therapy really is to deliver a high dose of radiation to kill the cancer in the radiation field, but also to minimize the exposure of normal tissue around the adjacent areas. And one of the ways you do that is by starting on with a machine that has the best foundation for it. We have two accelerators that are designed differently to accomplish those tasks. We have our state-of-the-art upgraded linear accelerator that includes dual energies and image guidance as well as stereotactic radiosurgery capabilities. That's our IX machine. We also have a brand new accelerator that we refer to as the Halcyon treatment unit. It's really designed from the ground up to be patient-centered, to have all the capabilities that we need to treat prostate cancer in a sleek, fast unit. The unit behind me right now is our Halcyon unit. It was really designed from the ground up by Varian to be patient-centric, meaning it was designed with intensity modulation and image capabilities from the ground up. Behind me now is our Halcyon treatment machine. It was really designed from the ground up to include quite a few capabilities that are meant to really deliver a high dose of radiation accurately and quickly. When the Halcyon unit was designed, it was really designed to minimize the number of steps and the number of places that things could go wrong before radiation treatment's delivered. And what that means is that it's tightly integrated. There are very few moving parts, and the parts that are moving are very solid state, which means that it's less likely to go down. You're less likely to have an interruption in your treatment. And when we deliver the treatment, it's delivered quickly and accurately while you're in the correct position. Over the past 10 years, radiation therapy technologies evolved tremendously. And with each one of those evolutions of technology comes an extra step in the treatment process that adds accuracy, but also adds a certain level of possibility for something to go wrong. It usually takes about 30 steps from the time the plan is conceived to the time it's actually treated. And what Halcyon was designed is to reduce those number of steps down to 9. The Halcyon unit is really designed to take the number of steps involved from 30 down to 9. And each of those 9 steps are really focused on patient safety and accuracy of delivery. One of the key things about Halcyon is its patient-centric design. What that means is that it's less intimidating and much more comfortable. When you come into the room, you see this machine that has a wide open bore. So if you're claustrophobic, it's not a big issue for you. As soon as you enter the machine, your head actually pops up on the other side and you've got plenty of room to breathe and see. One of the key features of our Halcyon unit is what's called a patient-centric design. What that means to you is as soon as you walk into the room, it's not a big scary machine that you're looking at. It's actually rather a sophisticated system that looks a lot like a CAT scan machine. It's designed to have a large open bore, so if you're claustrophobic, it's no longer an issue. It has a table that's designed to go in a very smooth fashion into the machine. And when you're in the machine, your head's actually on the other side so you can actually see and breathe without fear of being trapped. One of the advantages of the Halcyon system is really the patient-centered design. What that means to you is when you walk into the Halcyon vault, you're not presented with this big, scary, loud machine. It's actually sleek looking. It looks like a large CAT scan. The first thing you're going to notice is the large open bore. So if you're claustrophobic, that's not a problem. When you lay on the table, it's actually floating on an electric magnet, so it's very soft and non-jarring. When it enters into the machine, your head's actually on the other side, so you've got plenty of room to breathe and open and look around. Further, when you're on the treatment machine and the actual radiation is being delivered, your clue that the radiation therapy is actually on is a soft buzzing noise. There are no loud thumping noises, there are no loud clacking noises, just a gentle hum. And usually after about a minute and a half when the treatment's over, it slowly brings you out gently, and then the therapists are able to help you off the table. When you're on the treatment machine, your clue that you're actually being treated is a soft humming noise. As soon as the therapy's over, about a minute and a half later, the machine will actually bring you out automatically and slowly into a seated position. The therapist will then help you off the table, and you're able to walk yourself to the treatment area. And you're able to walk yourself back to the change rooms to get back into your regular clothes. If I was going to design a treatment machine specifically for treating prostate cancer, this is what it would look like. If I was going to design a machine to treat prostate cancer, this is exactly what it would look like. In addition to our Halcyon therapy treatment machine, we also have another accelerator called our Clinac IX. It's been upgraded with the latest dual energies, with a flattening free filter and a stereotactic. In addition to our Halcyon treatment machine, we also have our accelerator that's been upgraded to the latest technology for stereotactic radiosurgeries, called our IX. One of the important things to remember is that there is no one size fits all for prostate cancer. In addition to our Halcyon therapy treatment machine, we have our linear accelerator called a Clinac IX. It's been upgraded to include extra features that help patients that happen to be bigger by having dual energies. It has stereotactic radiosurgery accuracy, which means it's down to less than a millimeter. It's also been upgraded to arc therapy, which means like the Halcyon, it delivers radiation therapy in arc rather than from static locations. So whether you're treated on our Halcyon treatment machine or our Clinac IX, rest assured that you're getting a very tailored plan for you. One of the most common questions I get is this CyberKnife therapy? Well, CyberKnife is a brand. It's essentially an accelerator, and it has a pinpoint of radiation therapy that is required to move around in multiple areas. One of the questions I get asked frequently is this cyberknife therapy? Well, it's important to understand that cyberknife is a brand or type of radiation therapy that uses a single pinpoint of radiation to actually treat a broader area. One of the advantages of that is that it's very precise. One of the questions I get asked frequently is this cyberknife therapy? And the answer is cyberknife's a brand of type of treatment of prostate cancer. I think what we have to offer is actually better than a cyberknife treatment. And the reason I can say that is because radiation therapy with either of the machines that you receive uses volumetric arc therapy. It's a fancy word for saying there are thousands of small little radiation beams that accurately help define the treatment. One of the questions I get asked frequently is this cyberknife therapy? One of the important things to understand is that CyberKnife is a brand. It's a way of delivering radiation therapy. I think what we have to offer is just as good at, if not better than CyberKnife therapy. And the reason I can say that is with either machine that you get treated with, we use thousands of little points of radiation beams that really scoot around normal tissue and deliver a high dose of radiation very accurately and very quickly. A typical CyberKnife treatment can last about 30 to 40 minutes. With these, it's over with within about a minute and a half. The advantage of that is that we have onboard imaging. We actually get to see the area that we're treating. We're able to tell whether your bladder is full or your rectum is empty and the area that we're actually treating. And the treatment's over within about 2 minutes in short enough time that you're not moving around. One of the questions I get asked frequently is this CyberKnife treatment. What's important to understand that CyberKnife is a brand of radiation therapy delivery system. I think what we have to offer, what we have here to offer actually has some advantages over CyberKnife. We use volumetric arc therapy, which means we use thousands of small little radiation beams that are precisely aimed at the area that we're treating. What this allows us to do is deliver a treatment in minutes. What this allows us to do is to treat within a matter of 3 or 4 minutes what other systems can take as much as 40 minutes. The advantage of that is that we can treat you before your body has a chance to move. What this means is we can treat you much quicker before your body or the tumor has a chance to move outside the radiation field. We also use image guidance in the form of a low-dose CAT scan. We also have the advantages of using image guidance with a low-dose CAT scan. What that allows us to do is evaluate how full your bladder is and how empty your rectum is for each treatment. With our recent upgrade to our IX machine, we have the capability of treating with volumetric modulated. With the addition of Rapid Art to our IX therapy machine, we now have two machines that can treat using volumetric arc therapy. It's a fancy word for saying you have a continuously sweeping, dynamic changing radiation field that's aiming the radiation therapy at the prostate and carefully avoiding the normal structures on a continuous basis as it sweeps around your body. What that means is that we're able to deliver a dose of radiation over a shorter period of time before the cancer has a chance to move outside the radiation field. We've recently upgraded our IX machine to rapid arc therapy. What that means is we now have two machines that can use a form of radiation therapy called VMAT, or volume modulated arc therapy. It's a fancy word for saying that as the machine rotates around you, it's continuously and dynamically changing the radiation field intensity to avoid the normal structures as possible, specifically the hips, and deliver the treatment over a shorter course of time. What that means is that you have less time to move outside of your perfect alignment. What that means to you is we're able to treat your session on the table in a shorter period of time. The advantage to this is that your cancer is not moving outside the radiation field with your normal breathing, and we're able to treat you in a more comfortable position. What that means is we can deliver the radiation in a shorter period of time. It has two advantages. It makes sure that the alignment that we positioned you in is the alignment that you're in at the actual time of treatment, and it allows us to get you off the table as quickly as possible. The advantage of that is that we're able to treat you in a shorter period of time when you're on the table. What that means is that the cancer has less of a chance to move outside the radiation field due to the breathing or filling of your bladder or rectum. It also means that you have to stay still for a less period of time. The advantage of using rapid arc therapy, or VMAT, is that we can treat you in a shorter period of time. It has two main advantages to the patient. One is We get to treat the cancer before it has a chance to move outside the radiation field due to breathing or bladder filling. Also, it allows you to be treated quicker so you don't have to stay perfectly still as long. Some cyberknife treatments can take anywhere 30 to 45 minutes. One of the biggest challenges for radiation therapy is to deliver an accurate dose within millimeters. Every morning when our machines go through their morning QA, we put a phantom on the machine. Even if that phantom is off by a half millimeter, we're able to detect that difference and stop the treatment. One of the challenges to radiation therapy is delivering a high dose of radiation to a very precise area within millimeters. The way we accomplish that is by going through our morning QA. If our morning QA phantom is even off by a half millimeter, we'll notice that difference. That's how accurate our machines are. This level of precision allows us to actually target the treatment to the cancer itself and spare the normal tissue as much as possible. One of the questions that I get asked frequently is, what role does a physician have on the daily treatment? Obviously, I'm not there for every treatment in the room with you. What we do is we have a crew of radiation therapists. They're all licensed by the state and they're accredited to treat patients with prostate cancer. But our therapists are special. They treat prostate cancer 99.9% of their day. So they are better trained than other therapists to actually identify a prostate, to execute a radiation therapy plan, and to know when a radiation therapy plan is not going well. So their goal is to make sure that you enter the room safely, that you're lined up perfectly so we can start the fine tuning. They're responsible for the fine tuning, and they're responsible for taking an image of what they've actually treated to present to me every day. I look at those images on a daily basis to make sure that they're treating appropriately. So there's a level of supervision that's unsurpassed for treatment of prostate cancer at our center. So there's a level of expertise that you're going to find with our radiation therapists that you're not going to find at radiation centers that treat different types of cancers. Our radiation therapists treat 99% of prostate cancer all day long. So they're trained, they know what to look for when it comes to a radiation therapy plan. They know what a good plan looks like. They know how to set up a good plan, and they know when a plan doesn't look right. They're responsible for actually taking pictures of what they treated and presenting to me at the end of the day so that I can rest assured that what I designed for you is what's actually being delivered. I want you to rest assured that your goal is our goal. I want you to rest assured that your goal to get a proper radiation therapy is also our goal. And we've done our part to bring the latest technology to Central Texas to make sure that we have an expert team to deliver the radiation therapy and the technology behind it to make sure it's state of the art. I want you to rest assured that your goal to get a proper radiation therapy is our passion. We've assembled the technology, the expertise, and the delivery system to deliver a radiation plan that's accurate and precise and intend to cure. I want you to rest assured that your goal to get a radiation therapy that's accurate and intended for cure is our passion. I want you to rest assured that your goal to get an accurate and radiation therapy plan intended to cure your cancer is our passion. We've assembled the expertise, the technology, and the delivery team to do just that. I invite you to visit our website, austinradiation.com, to learn more about. I invite you to visit our website, austinradiation.com. I invite you to visit our website, austinradiation.com, to learn more about radiation therapy. I'm Dr. Richard Garza, radiation oncologist. I'm Dr. Richard Garza, radiation oncologist at the Austin Center for Radiation Oncology. Thank you for watching.
Good job.
Okay.
A lot of good material. Now it's going to be an expert putting it together.
And a little bit of background music. I like
So there's one other thing I want you to say, and then that'll be it.
Good out.
What I have in my hand here is what we call spacer OAR gel. It's a very pliable, soft, jelly-like substance that we put between the prostate and the rectum to shield the rectum from excess amount of radiation therapy. At the Austin Center for Radiation Oncology, because we treat so many prostate cancer patients, we have the most experience with this in Central Texas. We probably do the most out of anywhere else. What I have in my hands now is an example of what this spacer OAR gel looks like. It's a very pliable material and it's designed to be in your body for about 3 months. After about 3 months, it starts to dissolve away. But while it's in your body, it creates a space between the prostate and the rectum, so we really reduce the amount of radiation exposure to the rectum. What that means too is you're going to have less rectal side effects in the long run.
No, that's fine. That's perfect. Now, the only other thing I would ask that we do, and this is Dr. Hardiman is really for the first video, both of these are for the first video, is I need you to say like a one sentence or something about artificial intelligence, prostate mapping. That we do that at the center. I don't know if you, I wouldn't use protege AI, those words. I would use artificial intelligence, prostate mapping.
At the Austin Center for Radiation Oncology, we're always looking for the latest technology and the next advancement. And the latest topic in radiation therapy is the use of artificial intelligence. We use artificial intelligence in our radiation development process to really make a difference in the utilization of our resources. At the Austin Center for Radiation Oncology, we're always looking for the next advancement, the latest technology. And the latest key technology in radiation therapy is the use of artificial intelligence. Artificial intelligence comes in many different forms, and one of the most exciting ways is to help us identify the areas that we need to aim the radiation therapy at. We use artificial intelligence to help identify the normal structures as well as the cancer structures with our radiation therapy planning process. We use AI, or artificial intelligence, to help us identify the prostate cancer and the normal structures and to deliver a precise radiation dose. We use artificial intelligence in radiation therapy to help us really design a more accurate plan. Artificial intelligence allows us to get rid of the mundane things that can lead to human error. But it also allows us to change our focus to be more critical of what we have in front of us to make sure that we're actually delivering the radiation therapy to the part where we need to. We use artificial intelligence to help us develop the perfect radiation therapy plan. It allows us to use computers to get rid of the areas where human error can happen and allows us to change our role to be more critical of a radiation plan. We use artificial intelligence to help us develop the perfect radiation plan. In places where there could be human error, we've now replaced it with computer programs. This allows us to change our role to be more critical of a radiation therapy plan and identify things before they become an issue. We use artificial intelligence to help us really design the perfect radiation therapy plan. Essentially, what we do is we've used a computer to eliminate the areas where a human can actually mess up. We use artificial intelligence to help us develop the perfect radiation plan, accurate and almost foolproof.